process issues in psychodynamic psychotherapy. We'll cover transference and countertransference, resistance, interpretation, and working through. Starting with resistance. Resistance is anything which the patient does that becomes an obstacle in the therapy process. Being silent in the session, not sharing something, agreeing to everything, missed sessions. So, resistance can be verbal or it can be in action, and this can be unconscious or conscious. So, this resistance is important to help you understand what is difficult for the patient to talk about or to feel. To identify resistance, we have to first pay attention to the flow of thoughts while the patient is free associating. If there are any silences or sudden change of topic, these are clues to resistance. There can be other examples of resistance: acting out, or the behaviors that they do or engage in outside the sessions, or acting in, which are behaviors which occur within the sessions, during the sessions, or even during free association, not engaging meaningfully. After having listened to the patient and having noticed signs of resistance, the next step would be to decide whether this needs to be brought to the patient's attention. So, if we are using uncovering strategies, that means that the patient can tolerate unconscious material bringing to the being brought to the conscious. That's when we bring the resistance to the patient's notice. If you're using supportive strategies primarily, so we know that either it is due to temporarily or chronically weakened ego functioning. And if we are using supportive strategies, it would mean that the patient has some difficulty in bringing up the unconscious material into their conscious. And therefore, we take a supportive role. And in this kind of a situation, we choose to just note the resistance. And we bring it up once we have trained the patient in having better tolerance of the unconscious material. There may be different reasons for resistance. One would be fear. This fear could be fear related to change or fear of uncertainty or something that is not known at the moment. Or there can be a reluctance of letting go of the way in which they used to previously deal with aspects of their life. Avoiding any anticipated losses. That if you delve into the unconscious aspects of their difficulties, they might lose certain things, certain gratifications that they're able to maintain because of the resistance, because of not letting the unconscious thoughts, impulses, emotions into the conscious. Next, it could be due to guilt, because they might find it difficult to handle the guilt that they might experience because of the if the unconscious material is brought into the conscious, or if they let go of the resistance, they might have to deal with some aspect of guilt, some amount of guilt, and they may not know how to deal with it. So in order to avoid experiencing the guilt, they might resist. Next is shame. They might experience shame associated with some of their unconscious fantasies, desires, impulses. And in order to avoid experiencing the feeling or emotion of shame, they might engage in resistance. It can also be due to therapist error or any mistakes of the therapist. So, if the patient perceives that they may have been misunderstood or due to some actions of the therapist, they might feel that the therapist is not able to understand them or empathize with them, or if they feel that the therapist is not interested, not showing enough interest, could lead to resistance. Next is intervention or intervening. Some basic interventions include psychoeducation, telling them why they would need to speak whatever comes to their mind, how it would help. Asking them questions such as were they thinking something particularly when they were silent, or when they quickly changed to the topic, was there something that made them suddenly change the topic at that point of time, or what were they thinking or feeling when they were talking previously about this? Then giving them some directions, um, asking them to talk about when they were quiet, and empathy or showing empathy. There are some supportive interventions where you use directions. You know that you cannot directly bring up the resistance to their notice. So you support them, and you help them, giving some practical suggestions. Let's say if they're missing the sessions or if they're getting late to the sessions, then what if they could use some reminders. Uncovering interventions. So this is when the ego strength is better and they can tolerate psychodynamic interventions. So confrontation can be used. You can check with them. I noticed that you felt silent when you were talking about this, or I noticed that you did not say much about dash. You can use clarifications. You can check with them if one aspect of what has happened is related to the other aspect. So you can check for any links between two things which on the surface seem unrelated, but what if they might be related to each other? So you clarify, asking them if these two aspects are linked to each other, and making interpretations. So once the therapist is able to identify that there is some unconscious reason for resistance, however, making interpretations with empathy is important because interpretation can feel threatening, because resistance is something that they're using to try to protect them from actually facing the aspect that they're resisting. So the interpretation might bring that up to their conscious awareness, and it might feel a little difficult for them. It might be hard on the patient, and so it can be um, shared in a more collaborative and curious manner.